Sergeant Jamie Sipes has spent the last 2 decades working for the St. Paul Police Department. In 2016,
We started researching progressive programs across the United States, Canada, and overseas.
to expand the department's response to crisis-related calls for service. 2 years later, the St. Paul Police Department started a mental health unit, later referred to as the Community Outreach and Stabilization Unit, or COAST.
This program is special and unique in that we partner with community-based resources to respond to crisis-related calls together.
Most recently, the department introduced this refurbished mobile bus with trained outreach team members to provide chemical dependency outreach and mental health assessments to those in need.
Out of the cold, out of the heat.
Officer Justin Tiffany, who spearheaded the department's Recovery Access program, says with an increase in mental health-related calls, following up with people who experienced overdoses, those in need of service referrals and outreach is crucial.
And then connecting them with the various services and getting them connected with our licensed alcohol and drug counselors so that they can get the necessary referrals, assessments.
While the program is receiving outside support,
So we were very fortunate to be recognized by the Minnesota Department of Health as being a program that they wanted to be associated with. They approached us, they offered us money.
they're hoping to continue expanding the program to bring more resources to the community. In St. Paul, Charmaine Nero, KARE 11 News.
Well, St. Paul Police Department's COAST program consists of 1 alcohol and drug counselor, 3 licensed social workers, 1 sergeant, and 5 police officers. We've included a link on our website to learn more.